This is a complex case of revision arthroscopic rotator cuff retear repair with the bioinductive patch augmentation. You can see the MRI showing the retear of the supraspinatus tendon, and arthroscopically you can see that the retear at the junction of the musculotendinous junction, wherein the supraspinatus tendon is not easily reducible. You do a subacromial decompression and also prepare the footprint initially, and the loose anchors and the sutures which are not holding the cuff are removed. There was one anchor which was loose which had to be removed. These are the peak anchors which was used previously, and those sutures are also out. So considering the cuff was not mobilized easily, we had to mobilize them and also evaluate the glenoid was looking good, and we had to release the cuff both superiorly and inferiorly and medialize the footprint. This is the medialization of the footprint of attachment of the rotator cuff, wherein the medial anchor will be placed. A curette is used to clear that area. This is the medial anchor with a triple loaded anchor, and one of the limbs will be used to repair the biceps tendon. So that's the biceps tendon being, biceps tenodesis being done. This is the traction stitch. Once the repair is done, you can see now the rotator cuff is covering the footprint well. So now the place is being prepared for the lateral row anchors as well. That is a lateral row anchor. Now you can see the rotator cuff being mobilized completely to cover the footprint. Slowly as the anchor is being placed, the rotator cuff is being pulled well and completely covering the footprint. Now, this is the fully repaired rotator cuff with the biceps tenodesis done and reasonably less tension with a good subacromial decompression as well. Since the quality of tissue was not good, a bioinductive patch is being used. This comes in both the medium and large size. A medium size patch is used. This is a delivery system. You have to be careful that you place this 2/3 on the cuff and another 1/3 on the bone side. That's a humeral head. These are the PDS anchors which are there, which will be placed on the bioinductive patch over the location where there's a cuff. Almost 8 to 12 anchors are available. You don't need so many of them. Maybe around 6 to 8 should be sufficient. However, you could use more. This PDS, and these are the blue structures which are the PDS anchors, and the delivery system is what is the metallic and the white thing which you are able to see. So that is released once you place the medial anchors. Now you can see the patch is well placed on the cuff part. Next will be to place the peak anchors on the bone. That is, the two peak anchors are available. These are special anchors specifically for this patch. So this is the first peak anchor which being placed, and after this you can see the other peak anchor, that's the second peak anchor which is released. This patch helps in building a scaffold and augmenting the tissue, and which completely dissolves by 6 months and gives additional strength to the tissue there. That's the first one which was placed. You can see the white thing, then and another second one is being placed. Once the anchor is placed, check that, rotate and check whether this patch is well or seated on the repaired location of the cuff area. So you can see once it's rotated, it's well placed and the healing is expected to be good. Post-operatively, we immobilize for 4 weeks in an arm pouch and abduction. Thank you very much.